Thank you for joining us today. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders. My name is Nell Thompson and I'm the Secretary of the Australian Institute of Animal Management, and I'll be hosting the webinar for you today. I've been on the AIM committee since 2013 and I'm also the coordinator of the National Getting to Zero program. The Australian Institute of Animal Management, or as we call it AIM, is the national peak body representing local government animal management officers. The AIM committee consists of a wide range of professionals engaged in the various aspects of animal management. We're very lucky today to have two of our board members presenting, Tina and Annie. They graciously give up their time to volunteer on our board, so we very much appreciate all that they do. AIM seeks to support those engaged in the business of animal management and the function itself by providing training and information, opportunities for networking and collaboration, and by encouraging the use of best practice, policy and practices. AIM understands the significant pressures placed on local government and not-for-profit rescue and rehoming service providers when working in the companion animal management space. We welcome new members and people can join via our website at www.aim.org.au. So to the agenda for today. Once I hand over to our presenters, there'll be around 50 minutes of presentation and around 10 minutes of question time once the presentation has concluded. The recording of this webinar will be accessible via our website to all members to watch at any time. We're going to ask that everyone mutes themselves during the presentation unless our presenters indicate otherwise. If you have questions, you can start putting them in the Q&A section and we'll get through as many as we can at the end of the session. If you have very quick questions that relate to your understanding of the content, put your hand up and we will try to get to them during the presentation. And if you have more questions or we don't get to yours during the question time, you can send a message to our Facebook page and we'll get to it that way. As always, please excuse any working from home background noises that may filter through. We're very grateful to have Tina Martin and Anne-Marie Plastow here with us today from Cairns Regional Council to talk about planning their innovative West Cairns pilot animal management program. Tina Martin has had over 25 years experience in the animal welfare and animal management field. Starting off her career with RSPCA, she worked in a range of positions from vet nursing to shelter manager, all up and down the Queensland coast. This diversity of positions and locations for 14 years gave Tina an immense understanding of animal management issues faced by many communities. Tina now brings her wealth of knowledge to Cairns Regional Council as their animal management supervisor. Anne-Marie joined Cairns Regional Council in 2015 in a small outdated pound facility, but this never stopped her dreaming of making changes from the moment she stepped into the kennels. Making leading pound officer within 18 months, she used her tertiary studies, including 2 degrees, skills gained from other facilities, and sheer determination to improve the facility for the sake of the animals. Working in other large shelters and boarding facilities around the region, Anne-Marie gained a sound understanding of the range of public requirements from a council-run facility. Although she's still young in her council career, every day is a learning curve and there's no one better to take up the challenge. So over to you, Tina and Anne-Marie.
Thank you, Nell. Good morning, everyone. Thanks, everyone, for joining us today. We're going to walk through a pilot program that we started here a couple of years ago. Basically, we are going to so this lovely photo is our small team that are piloting this program in Cairns. So if you don't know where Cairns is, we're Far North Queensland. We're the 5th most populated city in Queensland. We have a population of around 150,000 people. Our average annual growth is around 2.3% over the last 10 years. And it's our population is due to double by 2050. So obviously our animal management strategies here in Cairns are going to change immensely over the next 20 years, I guess, with the population growth. We've had a fairly decent growth just in the last couple of years, some due to COVID, I think, and at the moment we have quite a big turnover of properties and developments and things going ahead, so our population will probably increase in the next couple of years as well. Our council area encompasses about 1,687 kilometres. We have quite a large council area. We have an animal management team of 20 officers and 4 supervisors. We actually run our own pound as well as for our lost and found pets and animals that we seize due to dog attacks. So this is just a bit of an overview of our complaints and our data from our animal management team. So our team receives about 18,000 customer complaints annually. These complaints consist of animal pickups, stray and roaming dogs, dog attacks, and various other animal-related complaints. We seized and impounded 1,800 lost animals over the last year. And on average, we rehomed 456 and returned 560 to owners. So a little bit about West Cairns, which is our target area. Our target suburb, Manoora, is in the bottom 3% of the most disadvantaged communities in Australia. 30% of the population identifies low-income households, 15% are unemployed, and 17% live in social housing, compared to 3.5% across Queensland. So this area has quite a high rate of social housing and has had a fairly decent number of animals in every property as well. This is some of the data that we've collected over the last couple of years. So when we started the program, we had about 422 animal-related complaints a year. In the last financial year, that has reduced to 265 complaints. There is 725 animals currently registered in Manoora. Manoora had the second highest surrender rate for all of our Cairns suburbs and surrendering to council. And the population of Manoora was around 6,337 people. So talk to you about the background.
So a little bit of the background of the community itself. In November 2018, council was approached by some community members as well as some members who represent public housing and also access housing. We found that there was a huge distrust with not only our team as animal management, but across council itself. And we really struggled to do any sort of education and engagement within the schools in this area. There's 3 schools in this catchment area, 2 are public and 1 private. There's a huge amount of fencing issues exist because a lot of the houses are public housing, and there's that money that they have to put in complaints and fix the housing. So a lot of the times the dogs just aren't contained and they have no gates, or the gates aren't attached, or the fencing are completely broken. We have a resident in the area, so one of the community members that approached us, she was feeding over 70 dogs daily out of her own money, and she desexed over 40 animals just from that area. She was also paying for impound fees of animals that were picked up as strays, just trying to help the owners get them out. She was also paying for registration fees on dogs as well, so they can be identified and not picked up and impounded. A little bit of background on the dogs in the area. So we knew there was a huge issue with the dogs. We were aware, we assumed them because we'd worked in that area for a while. There is what you call, community dogs, where they're not particularly owned by anyone, they just exist within the community, wandering around getting fed by various people. Like Tina said, we have a really high surrender rate of unwanted animals in this area, as well as really high impound rates of stray animals. Because there's a limited vet work done on the animals in that area, there's always the risk of, when we have huge litters surrendered, bringing in parvo into our pound and then spreading that through the shelters if they then get moved on. Dogs, like I said, consistently roaming, and a lot of that is just due to the fencing issues. They just can't contain them because their fencing aren't adequate when they're in the public housing. There's a really high crime rate in the area. So a lot of the time people were having dogs to help protect themselves and help stop their stuff getting stolen, as well as a lot of welfare concerns for the dogs and cats that are living in this area. Like I spoke before, parvo is a huge issue. A lot of the animals aren't vaccinated. A lot of the times that puppies were being born on properties, most of them were dying within the properties quite shortly after being born. Unwanted breeding was a huge issue, and that's one of the reasons we accessed the area. A lot of dog attacks weren't getting reported at all to us, so we didn't have very good understanding of what sort of dog attacks were happening and what was actually happening in the area. Another thing that we assumed was a really high movement of the dogs, whether or not it was because they were dying and they were just getting more dogs, or if they were moving them between other areas, I guess, communities like Yarrabah, Wujal up on the Tablelands. So we found you just impound the dogs, they wouldn't get them out, they just get another one would move in from one of the other communities. If we had an issue with a dog that was seized because of dog attacks, it would just move into one of the communities and another one would replace it. So we wanted to understand why there was this really high movement and how we could slow that down and keep dogs in the houses. So traditionally in the area, we've only done reactive enforcement. We've never attempted anything proactive. So it was just, we'd just go up, if there was any complaints, we'd just deal with it. Most of the times it was people would just surrender the dogs because they didn't want them, they'd get a new dog. Animals, like I said, very basic vet work. So most of them were retired, a lot of the unwanted breeding, and very basic vet work was done. They were lucky if any vet work was done on the animals at all. This had really high flow-on effects, not only for our pound, but also for the shelters having to continually get puppies from these areas. And if they had issues like mange or parvo, that would have huge impacts on the shelter and the cost itself, as well as to our pound. We're quite a small pound. We're trying to keep that stuff out so we didn't shut down movement of other animals from other areas. And there was also that impact in the community. They knew that they had issues with parvo in their houses. They didn't quite understand what parvo was, but they knew that puppies, if they got puppies, they would die. If they had puppies, they would die. And then there was the poor ownership practices, which impact public safety directly. So even if they could contain their dogs, a lot of the times they didn't understand why they had to contain it or the benefits of having to contain them. So there was that issue of public safety of them being out.
So our approach to our program, we wanted to obviously develop a program that could deliver some outcomes for the community, but also give council some data around how we could better manage problem areas, I guess, or high complaint areas, which also, I guess, basically meant that we could save some costs in the delivery and obviously cost in some of the impounding of animals that we had. So we were very lucky that we had the Department of Housing come on board, as well as the community and council. So we have a multi-agency approach, I guess, to the program. We have made it a 3-year program, so it's not just a year in and then a year out. And we don't see any a flow-on effect of the time frames. So I think a year would have been way too short to get any meaningful data out of it and see any change. So we have made it a 3-year program. Obviously, when we were approached by the community members and the Department of Housing, we spent quite a lot of time. We probably did about 9 months worth of meetings and talking to stakeholders in the area to work out how we could deliver a program that was suitable for the area. So there was quite a lot of work done before we actually started the program as well. But yeah, basically multi-agency approach and trying to get as much data as we can around the impacts of the program. So the program focus was tracking the movement of the population of dogs, like Anne-Marie said. We had we'd made assumptions that there was a high movement of animals coming and going through that area. generally because we were seeing a lot of animals come through our pound and then replacement dogs just being at the property within a very short period of time. So we wanted to get data on and tracking the movement of the population. We also included vet treatments to target the breeding and just try to increase the level of health of the animals in the area. And we also included an engagement and education component to the program, a lot of it dealing with children, so kids education and some adult education as well.
So what was within trying to understand our track of the movement of our dogs, we were seeking to understand the movement between the communities within our region. So we started off, we knew we had to get accurate numbers of the dogs within this community in particular. We started off with a really big initial audit where we didn't touch the dogs or anything like that. We just got some basic information, sex, what houses they were living at, if they actually did live there or if they lived somewhere else. That went over a 2-day period. And the goal of this first initial contact with the community was to engage with the owners and let them know that there is a program in the area and there is free vet work. And we were just getting some details around the dogs just to start off with. So in our baseline audit, we followed with quarterly audits. We do vet treatment days once a year, collecting and reconfirming that these animals are in that area and reconfirming the animal's details itself. So if they do get out, we can still identify them. We registered all the dogs in the area that were in the public housing houses, and we issued all dogs with name tags and regos. We did have an issue when we first started, where a lot of times rego tags were being swapped or stolen or bought because there was it was worth something. But because we swamped the area with rego tags and all the dogs were registered, we combated that. We ensured that all the dogs were microchipped as well and their details are up to date, and we check that again at all our quarterly audits. And we flag all the animals that are in the program in our council system so we can understand what issues we have with those dogs, if any other complaints arise.
So for our vet treatments, we obviously engaged a vet who is very happy to go out in the community and deliver treatments in people's houses. And he has been a fantastic person to have on board in this team, as far as he is very good at giving people information around the treatments that we're delivering and the value of those treatments. So he has been fantastic with the program. So the treatments that we decided to deliver were a superlorin implant, which is a chemical desexing, I guess. And the implant lasts 12 months. So the dogs are basically sterile for 12 months. We also microchipped all the animals, so we had information, and we could return animals to owners if they were found. We also did a Dectomax treatment. We have quite a large tick problem in Cairns, and we gave C4 vaccinations to all the younger dogs that were under 6 months. The vet treatments we are doing once a year. So when we do our annual audit to track all the dogs and make sure all the dogs are in the same properties, we then follow those audits up with a vet treatment day. We are also, when we're doing our quarterly audits, if we find new animals that need treatments, we are doing them through the year as well. But then once we get to our annual audit, we would just do the same treatments again. So we are trying to keep up with the new animals that are coming in. So we are trying to chat to people as we go around and do our audits and just keeping them informed in what was happening, and we always let them know when we would be back doing vet treatments. It was very difficult at the beginning, I guess, for us to get people on board, and I think that was a big decision factor in using the superlorin, because people didn't want us to take their animals away to get them permanently desexed. So by us being able to deliver these treatments at their property and their animals not needing to be taken away from the property was a big factor in getting them to agree to letting us do the treatments. We obviously had a trust issue right at the very beginning, so it was hard to convince people that we were going to take them away, do all these vet treatments and then bring them back. So we did all the vet treatments on the properties in the house, at their properties.
So our last aspect of the program was engagement and education. We developed and we're still delivering separate programs targeting children and then targeting adults. The adult engagement program, we found less adults were willing to attend our events. We started off thinking that if we just put on a barbecue, adults would turn up, but we canned that pretty quickly. We realised because there is that distrust in us as officers, they're not, and they don't know us, they weren't willing to turn up to our events. Now down the line, we have more adults coming to our Christmas events and our barbecue events that are mostly targeted for the kids, but they know who we are and what we're about. The engagement with the adults we found was more successful was when we're actually at the property doing the vet work itself and doing the audits ourselves. They have that one-on-one communication with us. It's like 5-10 minutes where we can talk about the benefits of everything, much more successful than just giving them information or just expecting them to know, or running an event and not having that interaction with us as itself. Essentially, we found impact was just by showing up and being present on the street, continually being there and knowing who we are and what we do, and that when we're not something to be feared of, and we're trying to help them and we're trying to help their animals. We've actually found now that we've had a couple of people approach us in the street asking how to register their dogs. They're new to the area and they may not be in a community house, but that was definitely a big win for us, from people where there was no dogs registered at all, from now coming up and asking us how to register their dogs. We did create some basic educational flyers and magnets that we do drop off of the properties as well. So if they need some additional information, they have that there just to back up what we're actually saying to them one-on-one whilst the vet's there doing the work on their animals. The kids program is less formal. We pretty much have a pop-up school essentially. We can attend the local park or the community centre depending on the weather and the time of year. We take our trucks. We have an education dog as well that we take down, so they have that one-on-one interaction with the dog that has some basic training, so then we can teach them how to teach the dog how to sit, to walk on a lead. And we've found that the kids weren't really interacting with their own dogs at home. A lot of them were scared of their own dogs, but having our education dog Dougie really broke down some barriers for them. We have developed a lot of education material just targeted to this community itself, and to the kids. And you ask them what's the difference between chemical desexing and permanent desexing, and they'll tell you what their dogs have itself. We also run Christmas events and school holidays and Easter events and that sort of stuff, depending on staff and the time of year as well. The weather, of course, it's wet up here all the time, so it does make it difficult.
So we did have a commitment from public housing when they joined this program, which has been really helpful for us, and probably couldn't have got this program going without their commitment. So basically they were willing to share tenant information with us. They actually changed their policy to be able to do immediate fencing repairs when we were reporting them during our audits. We were reporting, fencing issues outside of the audits as well. So if we had complaints about dogs getting out of their properties or wandering, and there was a fencing issue, we could contact housing and get the fencing issues sorted out straight away. And a lot of this, I think, worked really well for the tenants as well, because sometimes the tenants call and it can be weeks, sometimes months before anyone attends to fix the fencing. So I think the tenants found it really helpful for us to be able to sort out their fencing issues for them. During the audits, the housing officers actually introduced us to most of the tenants at the start, which was really good because they had someone they knew. We had someone the tenants knew to introduce us to them to start with. So we had that introduction to owners. We weren't just random strangers rocking up at their house and having conversations about their dogs. So the introduction was really helpful. They also follow up with own. We also get the housing officers to follow up with owners. Before we do vet treatment, sometimes they go around and just let everyone know when we're coming, so everyone's at home when we are doing the vet treatment, so no one misses out. They also have financially supported the program by giving us money for the education delivery. So they have supported us financially as well. And they've also given us access to the community centre for us to use when we're doing education sessions.
So a little bit on our results. We're about 18 months now, so about halfway through our program. And this is just some stats roughly so you can see. So of course, these have been impacted by COVID. Halfway through last year, it made it really hard for us to do the work we needed to do, but we still managed around it. Our baseline, we started off with some owners around 67, and it peaked throughout the year last year, and it's dropped a little bit by the fourth quarter, which was the end of last year. And we haven't, with COVID, I mean, these numbers are steady, so we haven't really been concerned about huge numbers of owners leaving the program itself. In terms of our dog movements, they've remained fairly steady throughout the first 18 months of the program. We did see a drop in the fourth quarter of our dogs that had gone, and most of these were equated to dogs that were dying. They'd either died from a dog attack, or they had jumped a fence with a lead on and hung themselves. It wasn't that a lot of the dogs were moving out and people were moving them to other communities. It was just, there was a fair amount of numbers of dogs that ended up deceased. We do put that down to, I guess, the COVID was quite stressful and people didn't have a lot of money, and yeah, that was just, the dogs were just dying. So in terms of the desexing itself, we've broken down to dogs that were actually permanently already desexed, and then ones that we were giving the implant, as well as people who were refusing to have the implant. Initially, there was that higher numbers of people refusing to have the implant. They just didn't really understand what the implant was about. But by the time we got to our fourth quarter and even our second and third, people were really keen to do it. There wasn't a lot of refusal. They understood that the other dogs in the area were showing, they were gaining weight, and their behaviours were a little bit improved compared to when they were an entire dog. And once again, our vet, once they knew us a bit more as well, by the fourth quarter, they knew what we're about, and they knew why we were there, and what they to take their dogs and steal them and stuff. So we did have that buy over by the time it got to the end of the first year. Other treatments that we gave to the dogs were a microchip, like Tina said, and we didn't have to repeat that throughout our program either, because obviously it is permanent. Our parasite treatment, we then give all the dogs again Dectomax throughout at our fourth quarter, so when we go back around again at that year mark. And the parvo vaccinations only to the dogs that were quite young, under that year to 18 months, due to financial issues there, as well as parasite. We weren't able to commit to give all the dogs, quarterly parasite treatments. So that's why we've gone with our fourth year quarter.
So the properties requiring fencing, obviously we're looking at the fencing issues every time we do an audit. It was quite a high number, I guess, at the beginning because no one had ever looked at the fencing before, all the issues regarding some of these properties and the animals living in them. But as we go through, obviously, we haven't had the huge numbers like we had, the high number at the beginning, because most of the fencing was getting fixed fairly quickly. So it's been fairly steady. Obviously, the fencing that is used in housing properties is generally timber fencing. The timber fencing doesn't really last very long up here due to the weather and being wet for half the year. So obviously palings get replaced fairly regularly. Most of the issues were around gates. People don't like to open and close gates, and a lot of gates get ripped off when you have high numbers of people coming and going from a property. But it was a steady flow of fencing repairs that we had done. So we had a minor reduction in dog attacks as well that were reported for this area over the first year of the program. Possibly due to the program, it could be that we had a steadier population of dogs. There wasn't so many dogs coming and going and different dogs coming and going in the area. Most of the dogs now that have the Super Lauren implants are quite calm. They're not too aggressive, I guess, and a lot of the ones that were a bit edgy at the beginning are fairly calm and easygoing now. Most of the ones, there's not as many wandering the streets either, getting into dog fights and things like that. So there has been a small reduction. There has been quite a good reduction in the impounding of animals as well, possibly because most of the animals in that area are now identified. So if someone does find a dog, they can return them to the owner fairly quickly. And yeah, everything is registered and microchipped there, so it's quite easy to return to owner.
So in terms of the results from the community perspective, we found that the level of trust and relationships we've built with the community has definitely benefited us, not only with the program, but other staff from our team that have to work in the area have noted a positive change from the community, more willing to give information, more willing to actually report issues as well to council. And they're finding, you know, when we first turned up in the area, a lot of people just hide in their houses and were terrified of us because there's that, you know, that fear that we're just going to come and take their dog. And of course, that was how enforcement did work before. But yeah, they're much more positive. They see our trucks now, and a lot of the people wave at us, and the kids will obviously try and get in. The community gladly welcomed us in our work that we're doing. You know, we're helping their animals, and they can see the benefits of us being there and the work that we are doing, and that makes them happy, and they like us, you know, offer us cups of teas and that sort of stuff. We try not to get stuck in houses too long because we've got a lot of houses to visit. And the kids definitely look forward to us now. If we take a car down that isn't an animal management vehicle, if we take one of our private cars down, they don't recognise us as easily. And when we first started, we weren't wearing our uniforms. We were wearing less, you know, like more friendly kind of gear. But now any officer that comes down to help out with the kids, we encourage them to wear their uniforms so they know what we all look like, and they know we're all the same people, we're doing the same work, and we want a positive outcome for the community itself. In terms of the results from the dogs, like Tina said, the dogs seem a lot calmer. So even our other officers in the area that have to work there find it a lot easier to work with the dogs, as well as a lot easier to return to the owners. We carry a lot of treats with us when we go in the area, and yeah, the dogs know us because we are the ladies who provide treats. They're really friendly with us now. We don't have any issues. We can walk into properties and yeah, the dogs just love us. We've actually not had any puppies born in the area since we've started, so that's a really big positive that we see, which means no puppies have died from parvo either. We've kind of, so far we have broken that cycle of unwanted breeding, and that was one of our biggest goals. The animals look significantly healthier, a lot fatter. Tina ran into one of the dogs from our program the other week, and she didn't recognise it. He'd put on so much weight, which is a really good thing. We want them to look healthier. That's why we're trying to work in the area. We're trying to raise that animal welfare standard. And the dog's behaviour has definitely improved. And like I said, the dogs are much more positive to not only us, but to other staff that work in the area. So we had a few challenges, I guess, when we started. The balls were definitely a challenge. It appears that everyone is very attached to their dog's testicles. I guess that was another thing that worked really well with the Super Lauren. We could explain to them that they weren't going to disappear. They weren't getting taken away altogether, but the use of them was going to be reduced. It is quite interesting when you look at the results after a year, or you look at the dogs after a year of having Super Lauren, their testicles really shrink, and a lot of people are like, what happened? They've got really small. So yeah, the testicles are quite interesting, and the attachment. But I think because we didn't have to take the dogs away and take the testicles away completely, people have been more on board with letting us use the Super Lauren.
A lot of the male dogs have become a lot calmer. They're not jumping fences like they used to do. They weren't out and about and having like 5 males at one house with a female on heat anymore. So yeah, it's worked out fairly well. The community engagement was a very difficult one for us to start with, I guess, because we had a fairly negative impact in that area prior to starting this program. The community engagement for us, I guess our thoughts of what we could do to start with were not what we ended up doing at the end. So I think the engagement and just going to people's properties and talking to them at their own property has been the best way to do it, I guess. It's really hard to just pop up and set up a barbecue and just expect people to come when you do not have any interactions with them prior to that. The registration audits we spend a lot of money doing annual audits and audits, like a full systematic audit every 4 years. Obviously these audits are very costly to council, but we don't get the information that we need, and that was proven from us doing our audits and actually going house to house and talking to people. And maintaining the trusting relationships. Obviously, like we said previously, we didn't have a very good relationship in the community before we started. So for us, we've tried to limit our enforcement if we didn't need to. We've tried to do more education around containing their animals and keeping them on the property instead of just issuing infringements or taking the dogs to the pound. So we're trying to maintain that trust there. If they're helping us, then we obviously are going to help the community as well. The year 2 challenges, COVID probably was a fairly big one. It sort of limited us into doing our audits as far as going to people's properties and having that face-to-face contact. It limited some of the education that we could deliver for the children's programs as well for a period of time. There were still dogs escaping properties, generally due to gates being left open. So we've done some work around trying to do education around keeping the gate shut. We've made some games up for the kids around shutting the gates and things like that to keep their dogs at home. And the adult education, I guess, is more difficult for us because we have to engage with them at their property. It's not something we can do just out in the street like the kids program. So our goals so far, obviously the unwanted breeding and having no puppies in the area for the first year was a fantastic one to reach. We weren't really sure that would happen as far as people bringing in new dogs and things like that. Obviously, because we have the support of the community members there that work with these dogs very closely, we are advised when there's new animals in the area, and definitely if there's new female animals in the area, we try to get them into the program as quickly as we can to prevent them coming on heat or getting pregnant while they're in the area. We're trying to keep the program as fluid as possible. Obviously, when you have COVID and things like that, and the way this community works, I guess we try to continually change with the community to keep up with the need. And obviously, there's been some really positive social impacts come out of this program as well.
So in terms of the next steps, we're going to continue our regular monitoring of the area and manage the animals that are involved, and like Tina said, new dogs, get them into the program as soon as we can to maintain our goals there. We are going to continue our education programs in the area with the kids, and we have found as time has gone on, it's much easier for us to do that because the kids all know who we are, so it doesn't matter where we do the education, they're going to be there anyway. We're exploring some opportunities to access grants to support the program viability, to try and extend it longer than a 3-year program, make it the norm instead of just something that we can because we have some excess money. We present the program to other councils in our region. We have done that through a few of our councils, as well as internationally we've presented it. And we consult with our library programs to see if we can get the library working in the area as well. These kids love reading, and we buy a lot of books for them, but they don't have access to a lot of that stuff at home. So we're trying to get other areas of council into the community and really help the kids out and just make the community a better place.
So I guess what's next after the 3 years? I think for us, it's really important to collect data that's going to support other outreach programs throughout Cairns. We want to be able to establish other, on the ground programs for proactive teams. So whether it is providing vet services or whether it is just education around animal care, the data will support what programs come out of this, I guess. We obviously like to encourage other councils to work with their housing agencies if you can and build those relationships, because it is more beneficial, I guess, to have that multi-agency program. And it has been really beneficial to us to be able to have those contacts when we have problems at properties. And I think us and them working together in this program really has benefited the tenants as well, because the tenants sometimes have barriers to contacting housing, and sometimes it was easier to tell us about their fencing issues, and then we pass that information on to housing. Or sometimes they just had other issues in their property and they would tell us and we would pass it on and it would get fixed. So I think it's built those relationships, I guess, with the tenants as well, with us and housing working together. We're also working with our FNQ ROC committee, which is the Far North Queensland Regional Council committee, on developing a social impact study as a result of this program, because we've seen quite a lot of impacts in the area. So that's about it from us. If anyone's got any questions, I'm really happy to take some questions.
I've been lucky enough to have seen a little bit of this program in action, and it really is impressive work. And both of you to be hugely congratulated for taking such a new way of doing things, and you're reaping the benefits, and having to continue it all through COVID and through lots of other challenges. I say the whole team needs a medal, because you're really making social change, which is so important for long-term change. So I've got a quick question. I don't see anyone else's hands up or anything in the chat. So before other people get in, actually I've got two questions. What would you say would be the single most important thing to consider if you were looking at all of this again? So, with the benefit of hindsight, what would you say would be the most important thing to give advice to other people looking at this opportunity?
I think for us, the engagement is probably key. If you can't get people on board to work with you, then you're wasting sort of your time and money. And I think a lot of, I know from my experience within councils are very good at chucking on a big barbecue, lots of fancy, come down to the park and look at all these things, but generally it doesn't really work out for the right people, and you're not reaching your target people, I guess, with that. I know it sounds very labor intensive, like door knocking and going to people's properties, but for this community, that was really the only way we could do it, and that was probably the best benefit of having that housing person with us at the beginning, who could introduce us. And then most of those tenants sort of knew that we were working with housing, and that, it was going to be a relationship that we could build. We don't obviously go with housing all the time now because they're restricted because of COVID, but we've built those relationships because we're there very regularly. The other thing is, I think you have to be there fairly regularly as well. If you just drop in and do one thing and then 6 months later you come back, people forget about you. It doesn't look very genuine, I guess. I think prior to starting, we had a lot of feedback some from the community, some from other organisations, that a lot of things go into these, like a lot of agencies go into these communities with a 1 year type program that they're going to fix everything, and then after a year they just go away, and then whatever work they did do is sort of forgotten about, and there is no long-term benefits to it. So I think for us, we wanted to make sure that it was genuine and that we could actually make some impact there, and not just go in and throw some stuff around and then go away and not have that long-term impact.
Yeah, so collaboration, communication, and patience. Three big
And
words.
it is quite time consuming, and you have to be very flexible. You know, what we perceived as what was needed probably wasn't what they wanted in the end. So for us, we continually change, you know, if we need to. If there is a different outcome that the community needs, we can try and deliver that. The education component of it with the kids, like we're generally pretty much now, all these kids we've been in contact with for a couple of years, we know them all pretty well. So, you know, when we go there 1 week, we'll ask them what they want to do the next time. So we're basically working with them on what we deliver there, so what they want to know, what they want to do, and then we try to put an animal component to what they want to do. So if they want to watch a movie because it's pouring rain and it's been raining for 3 weeks, then we find an animal movie that we have something that we can relate to in it. So I think for us, like as you go along, obviously you need a lot of patience and it is time consuming. And obviously this is not our one job. We have our own roles to do at work. But it is really beneficial if you have that time to be present in the community. I think even like sometimes if we work on the weekends, we'll drive through there and just have a look at if there's dogs out, and we have a chat to people. We get flagged down quite regularly if we drive around in there now, either by the kids or people that want to tell us something that's going on. So I think just being present is really important too.
It's a truly respectful relationship, isn't it? You know, goes both ways. So we've got some questions. Well, and congratulations, a great work, by the way, from Joy. And a question: have you found that the other work of animal management has reduced? So, e.g., impoundment and fine issuing, etc., so that this reduces the cost of the reactive work and allows more time for this proactive work.
Of course. So we definitely have had less complaints about wandering dogs there, obviously because we have addressed most of the fencing issues in that area. Most of the dogs have a superlurin implant now, so they're not wandering due to dogs being on heat, and there's probably not many dogs that are on heat there anymore. So there's obviously definitely a reduced complaint around the dogs wandering, and it's obviously the impounding has reduced as well. We can definitely return pretty much any dog from that program to their owner without them going to the pound. So it's obviously reducing our cost of impounding and having staff just in that area all the time picking up dogs or issuing fines. I don't think we've issued a fine there in the whole time we've done this program.
But it's also, it's not just the animal related stuff, you know, when we're in there, we have a CRM app on a customer complaint app on our phone. So if we see an issue that could be council related, we just put it through.
So
and
if
get
we
rid
see
of cars that are
abandoned cars or
water leaking or whatever, you know, we put it through, we get helping in other ways.
But it has definitely reduced the workload. Pretty much the only thing that other officers would go into there for now would be dog attacks, and like I said, that's sort of reduced. We haven't had too many in there now. Most of the dogs are fairly lazy now. They don't really want to go anywhere anymore.
Fat and lazy, yeah.
They're quite in good condition.
And so has that helped to justify the budget for the program with your councillors, for example, and CEO, executive, etc.?
Always at the end of the 3 years.
It's a quite tricky situation, I guess, with councils, or for our council. A lot of them, if we have a dedicated budget for something, they're not really looking at the expense. And I think when we started this program, it took a lot of explaining from us to explain how there would be savings and there would be benefits, because obviously we have a budget to run our pound, so they don't really care how many animals come through there because we have the money to run it. So for us on the ground, we see it as a saving. If we don't have those animals coming in and out of the pound, we're saving money on the cost of keeping them in the pound and us having to have staff in the pound and all those sorts of things. So I don't know, it's a bit of a funny one, that one. But definitely it is saving council money. And I think after the 3-year, once we get our data together, it will actually prove that there is huge benefit for us working on the ground instead of spending that money in the pound.
Just being completely reactive all the time, you know. That's why we did it. Right. We sold it as a data collection program, but
okay.
And like for us, there is benefits as far as we have a huge workload as it is. We picked this area because one, we had the housing support and we had the community member support. Obviously that community member is still feeding dogs and things like that, but she also will tell us when there's new animals there, so we can jump on those animals straight away, get them on the program, get them the implant. So we do limit the the breeding part of it. I guess if we didn't have that support in the area, it would have been very hard for us to do this by ourselves.
Yeah, okay. And a question, how did you negotiate the Queensland housing privacy policy issues?
We basically only use, so we're the only tenants and dogs in this program are from housing properties. So basically we got a list of the properties and just the tenants' names at the beginning. And then once we did our initial audit, we actually collected the details from those people for our registration. So then we collected our own data from those people. So they didn't give us any personal details like phone numbers and things like that. It was just the name and the house, the actual address.
And we share information back to them.
And we share it with them too, because some of their data isn't super current, and because we're auditing all the time, our data now is probably more current than theirs.
But it's also issues with quite aggressive dogs and that sort of stuff. We report it back to them so they can flag it on their system, so their staff are being as safer.
Yeah. So
there is that. It's a mutual. Yeah.
So many cross benefits. Any ideas about the costs of the Superlorin injection compared to surgical desexing?
It's probably more expensive.
We did it for a reason though. We did it because it wasn't that trust. We weren't going to, there was no way we'd get buy-in from the owners to let us take the animal and permanently desex it. We also investigated trying to get a vet in there and do a pop-up clinic, but because of
it was because we have vet clinics very close by, we couldn't actually do like a pop-up clinic there. We would have had to use one of our local vets, and a lot of our local vets don't see the benefit in it, I guess. So it's quite difficult to get any sort of low cost desexing type programs done.
Yes, it probably is more expensive, but in terms of the amount of animals we were able to get on the books and get the implant done, it benefited us more.
I think it was the treatment that we could use to get for us to achieve the goal we wanted for that period of time. I guess for the 3rd year, this is where we will be looking at whether we now try to permanently desex these dogs. And that's what we'll have to decide coming into our 3rd year, whether we will do the permanent desexing, whether we have the trust in us now that we can take the dogs to the vet and get them done. How we deliver that, we haven't sort of got to that point yet, but it's probably something we're seriously going to have to think about, depending on whether we can continue this program or whether we duplicate this program in other areas. We need to figure out what happens in the end, I suppose. And for us, end goal, I guess, having them permanently desexed would be the best solution.
We would say that
we can get to that.
We would say Superlorin, it did save us time in terms of we could just do it straight there at the property. We weren't removing the dog. We didn't have that extra staff, but also even though it's only supposed to last for a 12-month period, we have a dog that initially came into the program. He was done from the beginning, then he's left. He went up on the tableland, so he's missed his re-implant, and he's still got his original one. And we've left him as a test to see how long it does take him to recover from the impacts of Superlorin. So far, he hasn't impregnated an entire female that he's been housed with. So that's 18 months now.
Yeah, that's fantastic feedback. And just one more question before we wrap up. Were any of the locals worried about being caught for other infractions, perhaps while you were visiting, and therefore reluctant to provide their
No.
details?
No, I would say
No.
sometimes we would do our program and we would be there, you know, doing our work with the dogs, and the owners would do things that probably we should possibly report them for, but they just have a level of trust that they didn't particularly care.
I think
they knew us.
Yeah, I mean, think for us, we have tried to be fairly flexible with what we're doing. I mean, if we see something that is definitely wrong, so if there's welfare concerns, we definitely report them to the RSPCA. If we can't sort of sort out a welfare concern ourselves, because a lot of times we can go into the property and move a dog that's tied up in the sun, we can do that ourselves, and we do that. If it's going to be something that's a continual concern, or there's something that is a huge welfare concern, we would report it to the RSPCA. I guess we have that fine line of where we want to continue that trust, where we don't want to be getting them in trouble every time we go to their house. So it's sort of difficult for us, I guess, but we have reported child safety issues. So yeah, we do report other issues if they're severe and there's something we can't deal with ourselves, I guess. But again, we're trying to build trust in these people that, you know, every time we go to their house, we're not, you know, getting them into trouble for things. And look, to be honest, there's not really a lot of things that we could report them for. The child safety things come out of our education program. They're not at the person's house a lot of times. But when we're concerned about particular kids and things they're telling us, then we would report it. If there's a welfare concern about an animal, we would definitely report that as well. As far as like council issues, generally we're both officers in council, so we can deal with them ourselves as well. So if there's something that's not right at the property that's a council concern, then we can deal with it as well. So, but we definitely report if we have to. And you know, we did
training around what, you know, child safety issues.
Yeah.
We did training around that and how we do report it. We didn't initially when we first started, because we didn't think it was going to be an issue, but then there is a level of responsibility with us working with the kids in the community, and they're, you know, saying things to us and we're seeing things. So we did some training and we know what to report and we know who to report it to now. Yeah, and definitely our housing officer, who is our contact, she's part of a Safer Streets program that works with the police. So anything we're unsure about, we pretty much tell her about, and if she thinks that we should report, then it will go to the next level. The police are there fairly regularly too, and part of that program is they're making contact with the same people as we are. So there's a lot of agencies sort of working in the area trying to do the similar type of work, that, you know, keeping everyone safe and things like that. But we definitely report things. We see things.
One more question, sorry, just before we let you girls go. Everyone's so inspired by what you're doing, but what have you found is the best way to engage with adults in the community to deliver education where they participate, ask questions and actually take the information on board? And I think you've probably answered that with respectful conversation and engaging people one-on-one, but do you have anything to add to that?
I think sometimes too, I guess a lot of the kids will bring their parents to the park. So in that time where the kids are playing or doing the activities that we have set up, because there's a number of us in the park, like we can have conversations with those adults as well, or they will ask questions about things that they don't really understand. So that time where the kids are doing their thing, we have some adults that come to the park as well, and they ask a lot of questions about what we do and how to do stuff, and if they've got a neighbour that's not doing the right thing. Like, we're getting education out there by not just ear bashing people. I guess people are asking questions. So I think for us, the best way to do it is when people want to engage with us without us forcing those conversations on them. But we do have a lot of mums come down to the park randomly with their kids sometimes, and they engage and ask lots of questions and things like that. But yeah, it's definitely when we're at their property, they might
knowing the names of their dogs as well, I think really helped. So even if, you know, we recognize the people and we may not know the owners' names, we'll ask how's Dusty or how's such and such, and then that created a big
Conversation.
connection. It's that conversation, and we showed we respected their animals. So
Yeah.
it was like, oh, how do you know? And yeah, he's good, and I have this issue, and yeah.
I think too, when you're at their property too, they always raise other things. Like it may be that there's a car dump down the road and things like that, that they know we can deal with as well. So I think it's because, yes, our majority of our work is animal related, but because we work from council, we can do other things and we can report to council if they have other issues. So when you're at their property, they're asking you questions about a lot of different things. So it's just conversation, I guess.
I mean, there are very few adults that I know that like to be sat down and, you know, educated too.
Yeah, and look,
so why would we expect anyone to, you know, to respond to that?
We've been to properties where dogs are tied up in the sun. I knock on the door and I say, can I move the dog out of the sun for you? And they don't even come outside. They go, yeah, cool. I've got kids in the yard with me. We move the dog into the shade and we give it water, and the kids are filling up the water buckets and stuff. So, I mean, I think for us, we are really quite focused on the kids because the kids are the ones soaking up all this information. The adults aren't too concerned about us being at their property anymore, which is really good, because before, one, they wouldn't come and talk to you to start with, we'll let you anywhere near their property or their dogs. So we've built that level of trust where we can go and move a dog, or, you know, ask them to move the dog because it's in the sun and explain why they should move it and things like that. So yeah, it's very fluid. It changes all the time, and you know, if someone's doing the wrong thing, we're pretty happy to have those conversations as well, and explain what needs to happen.
And it's the right
well.
people you choose to
Yeah,
deliver that
definitely the
engagement.
right choice.
You know,
people.
if you have people with certain negative attitudes towards a community and towards those areas, it's not going to work. It's not going to work at all.
No.
And these people pick up on that sort of stuff. Like,
oh, absolutely. Yeah. Was there anywhere that you sought support or information or guidance from when you were considering setting up this program?
Community elders. We did have a representative.
So we had a meeting with the community committee. They have a community centre there, and they have like a community, it is called a committee of people that live in the area who you know, advocate for the community and want, you know, certain things to happen in their community. We spoke to them. We spoke to the guys from the RSPCA. We had lots of conversations with housing on how it could be delivered. We have a community services team within council that do a lot of work in that area as well. And they gave us some good ideas on how to do the engagement type work. We went up to the council at Port Douglas, because they have a community up there that they did a similar program to. So we spoke to them on how they delivered and what they delivered. Yeah, so we did a lot of consultation, I guess, in that first 9-10 months before we actually started the program and got our budget allocated and things. So
fantastic. Well, I'm sure there'll be many more questions coming your way via email and perhaps through the AIM Facebook Messenger. But thank you so much. Keep up the great work. We've really enjoyed hearing from you today. And everybody, if you keep an eye on your e-news and our social media channels, we will announce the next webinar for next month fairly soon, and feel free to send us through any suggestions of topics you'd like to cover or speakers you'd like to hear from. So thank you very much for attending. Thanks, Tina and Annie, and take care, everyone.
thank you. See you later.